what I would probably, okay, so I would go through all those ortho tests. After I would tape it, after this tape, I would actually ask the patient to ice it, 20 minutes. So we're gonna be making, well, you guys are gonna be making bags of ice. They'll have a big thing of ice, you're just gonna be making little baggies and we'll throw it in the cooler. Or in like a little pool, waiting pool. And the patients can just grab it and just ice. I think icing is probably the best thing. They complain at the end of the day, you can look at them, you can do some soft tissue release, ice, grab some ice. So stabilizing the ankle, there's a couple ways to do it. Can you actually bring your heel off the table? Heel. Perfect. I'll start off with a horseshoe.
This is for the ankle?
Yep. So he's in dorsiflexion. You start above the the lateral malleolus with about 1.5 inches of no stretch base. Oh, that's not true. You start up above the lateral malleolus, no stretch until you hit the lateral malleolus. And once you hit that lateral malleolus, you pull the crap out of it, and you go underneath the calcaneus, like that. Come up to the medial malleolus, and then no stretch on the way up. The biggest trick that you guys, the most difficulty you guys might be having if you don't tape a lot, is calculating the length. And it's gonna be just guessing. And you're gonna make errors, and then by the end of the weekend, you're gonna be pros.
So you went above the medial malleolus?
Yeah.
Okay.
So, again, no stretch above the malleoli. Once you get to malleoli, stretch the crap out of it. So this kind of helps with the talar tilts, talocalcaneal tilt. But truly, if I want to stabilize it, the kinesiology tape isn't the best. If you want true stability. Leuco tape, McConnell tape, the white athletic tape is probably the best. But if I feel that the participant can continue on with activities, then kinesiology tape is the best because it still maintains some sort of function. If I were to lock the joint like this and he has to walk 8 more miles, this is gonna hurt. The hip's gonna hurt. His back's gonna hurt. Possibly his other things are gonna snowball. At least this minimizes. He's probably gonna have residual effects nonetheless, but at least it decreases the likelihood of him having problems.
Why did you take it like that?
Lateral tilt stability or sprain. So the next one we're gonna do around the horseshoe. So dorsiflex again for me. We'll start off at one side. Doesn't matter which side for this one. And we'll kind of horseshoe around it. Probably should start a little bit further up now that I think about it. No stretch, stretch the crap out of it, come back up, and no stretch. And you can see, because I started off too posterior, that I miscalculated the length of the tape.
50% or 100%?
100%, if I'm doing stability.
Okay.
Yeah. Or close to it, 75 to 100%. Please throw me that garbage can for me, Sean. Thank you. And then lastly, the talofibular ligament, you want to kind of stabilize as well. So you can actually start posterior to the malleolus here.
Is this all for the same taping?
Yep.
Okay.
A couple ways to do it. You want to cross it, so we start off with one taping technique, and we'll continue on. Right behind the malleoli, come across, and underneath the foot.
Their foot is plantar flex when they're doing this?
It actually could be in neutral for this last one.
Okay.
Yeah. And then the next one, you want to cross it in almost a 90-degree fold. So you start with the top. We can do it this way. A couple ways to do it. We can actually go behind the foot. Come this way.
75%?
Yeah. Okay.
Now, would you do the edema?
How's that feel? How does this feel?
Pretty
That's pretty
stable.
good? Pretty stable?
Yeah.
Okay, good.
Would you do the edema tape?
Yeah,
And
it's,
then-
it's underneath on black.
Okay, you would do all of them, okay.
Yeah, I would do the edema tape first, if it's swollen. If it's
Mhm.
not, I just place the purple.
Okay.
So it acts as a compression, this part of rice.